Good afternoon, ladies and gentlemen. It is indeed our pleasure to join you for this, our very first podcast. We are advocates for community awareness, and we're excited to come to you in this format. Some of you may have heard of us. We are a small nonprofit organization based out of Bridgeport, Connecticut, and our mission is to raise awareness about inequities in communities of color. And we are really excited to talk about this topic today. Some of you may have heard there are some huge disparities in the communities of color as a result of COVID-19. And we have a really special guest with us today, and she's going to be talking to us about that. But before we get to the introduction of our special guest, I'd just like to take a moment and introduce our Advocates for Community Awareness team. My name is Kim Bianca Williams. I'm here in the city of Bridgeport. We have Kathy Dockery, who just recently moved to the great state of Virginia. And then we also have Alicia Thompson. She is also in the Stratford area, close to Bridgeport. And we have one of our members who is missing today, and we miss him dearly, Steve Lickman. He is also a Connecticut resident. So that's who we are. Alicia, would you please introduce our special guest for us today?
Oh, sure, absolutely. So I have the honor of introducing Tekisha Everette, and she is the Executive Director of Health Equity Solutions. She has built a successful career in public policy, particularly healthcare policy and advocacy in the nonprofit, state, and private sectors. Before taking the helm of Health Equity Solutions, she served as the Managing Director of Federal Government Affairs with the American Diabetes Association, where she provided strategic leadership on policy and advocacy initiatives with the White House, Congress, and several agencies. Tekisha earned her doctorate in sociology with a concentration in race, gender, and social justice as it relates to social policy. She's an alumna of the Master's Series for Distinguished Leaders and the National Urban Fellow America's Leaders of Change program. So we want to welcome you here today.
Thank you for having me. This is a great honor. I love what you do.
All right, so I'm just going to go right in and just ask you the very first question. So the first question that I have, can you define health equity, or what is health equity, would you say, between health equity and health disparities?
So I thank you for the question, and I really appreciate that question, because what I've discovered and I have found is that you can talk to 100 people in a room and ask each of them their definition of health equity, and they will provide you a different answer. So when we're having a conversation about equity, and particularly for Health Equity Solutions, which I'll explain in a moment, is focused on racial equity in healthcare or in health, it's important to level set and make sure we're all on the same page about what we mean and what we're talking about. So health equity in general, or I should say specifically, means that everyone has their opportunity to attain optimal health without any barriers, and particularly barriers that are created and caused by social or sociocultural or social demographic characteristics, such as race, ethnicity, geography, socioeconomic status, etc. At Health Equity Solutions, we primarily and specifically focus on racial equity as it relates to health and healthcare access, because the research shows us that the individuals who are impacted the most by structural inequities that exist are people of color. So we can correct and fix the healthcare system or our healthcare design or our healthcare delivery to work for communities of color. We know it'll work for everyone. So primarily speaking, we are focused and clearly focused on advancing strategies that will advance health equity for racial and ethnic minority populations in Connecticut. Now, the second part of your question about disparities, it's a really important distinction. For the bulk of time, and it's not brand new, we've been talking about the differences that exist between Blacks, Latinos, and Native Americans and Asians versus those of white people for a very long time. So any of the listeners who are listening, as well as all of you, have probably heard some statistic that compares a group of people of color to a white counterpart and saying they experience some chronic condition or some disease more than another person who is white or a community that is white. That's basically describing a health disparity, a gap in health care or health, and a disease burden of one community compared to some reference group, often another community. Now, I want to be clear in saying we don't think that that's necessarily problematic. There's some value in looking at health disparities, but the challenge in having a disparities lens does not allow us to go deeper and look at the structural inequities and inequalities that are actually driving those healthcare outcomes or health outcomes we see. It also doesn't honor the community in and of itself. So when you look at disproportionality, for example, we're all having this conversation during the COVID-19 pandemic. If you look specifically at the number of cases or deaths in proportion to population size, you're looking at the group itself and comparing how they are faring at a rate to themselves, not referencing another group. So this is why we advocate for having conversations rooted in equity. It allows us to both acknowledge something different or less than ideal is happening in a particular community of color, and we can advance and understand the underlying strategies that are driving those outcomes. Underlying issues that are driving outcomes that we are seeing. So that's a difference between disparities language and an equity lens.
Thank you. Thank you for answering the question. I have a very quick follow-up question. You mentioned data. Now, since the census that we're all doing this year, Census 2020, in terms of the census data, how do you think there's any data in relation to, I know that depending on what the data shows, for, let's say, for example, it shows that in a specific community, there are 1,000 people living there. And then within that community that have the 1,000 people, 500 of that 1,000 are minorities. And I know I've heard before that there's particular type of funding based on the amount of people that complete the census. So I don't know, can you just shed a little bit more light just to say if there's anything dealing with the census and if there's any kind of funding or anything in terms of when it comes to the health disparities?
So this is the kind of question that I love because it's not actually evident to most people how completing the census and Census 2020 is a health equity issue. Here's why. The data that we use for many public programs, Medicaid, food stamps, SNAP, actually is what we call it now, the Supplemental Nutrition Assistance Program. All of these use in some way census data to determine the formulas that states get in terms of funding from the federal government. So when we look at that aspect, the census is really important. Pair that with the fact that many decisions that are made on a state and local level are driven by census data. Even if you go to the point of thinking economics and where businesses locate in communities, it's driven by the census data. When we look at spending, where we place new parks or where we locate parks and what communities, that's all driven by the population of people there. And so one of the things that we're really concerned about is the chance that in our urban cities, especially in our urban centers, the chance of an undercount. And what we mean by an undercount is that people are not showing up in the census data. They're not completing the census, either because they're afraid or are not understanding the importance of it, or even merely because they don't have internet access because it's all online right now. So we're really clear that it's important for communities of color, particularly as one of the groups that tend to be undercounted. Children tend to be undercounted. Our LGBTQ plus communities, and undocumented individuals, all of these individuals tend to go uncounted. It's important for them to understand the census is a safe and important document that we all need that data. So to complete it, one of the things I've been saying lately, each one complete one and ask someone else to do it as well. It's really important that we do it because it really dictates the services and resources that are put into a community. And we know the people of color and underserved and impoverished areas, we definitely need those resources.
Wow, thank you so much.
Yeah, and I forgot to add one important piece too. It really factors into education. And we think of education as a definitely key piece of health equity. When we look at health disparities, we know that there's a difference and a direct relationship between healthcare outcomes and your educational attainment. And resources are dictated around education from the census. So it's a perfect question to ask in a conversation about health equity, and I thank you for that.
And thank you for just expanding and just giving us a better understanding of how that works. So I'm going to go ahead now and turn it over to Kathy.
Great.
Thank you. Tekisha, this is phenomenal that we're able to talk to you at such a critical time about health equity and everything that surrounds that topic. So the next question that I have is focusing on the current pandemic. How is COVID-19 impacting health equity?
So let's just take a step back and acknowledge this is a very unprecedented pandemic for many of us who are living in this time. Now, it's not something that we haven't seen before as a historical perspective, but many of us in our days and lives living on this earth have never seen anything like this. And so it's really important to acknowledge the number of things that are happening in everybody's life and in every community before I start going really deep into some of the things that are really relevant around communities of color. We are all suffering at this point, financially, spiritually, socially, all of the different ways that you can think of. We're all really impacted by this pandemic. The challenge comes into place is that if we take a utilitarian or universal approach to targeting our efforts and understanding, we miss the fact that some communities are impacted differently than others and have a depth of impact about this pandemic that many of us don't understand because some of us have the privilege to not have lived there. So when we think about COVID-19, it's really critical that we take a step back and think about the difference between aggregate efforts, these big, large, important, sweeping emergency responses that have to happen at a state level or at a local level when any sort of emergency happens, and really start to think, how are communities being impacted by this differentially? And we have to think about communities in a number of different factors. Geographic communities. When we look across the state of Connecticut, thinking about how folks in Hartford are experiencing, or Hartford County are experiencing this different than people who are living in Fairfield County, and how even within those counties, different cities and towns are experiencing this differently. That's one way of thinking about the impact on communities. The second is thinking about, well, who lives in those communities and where in different places are those individuals living? Who are they? What do they look like? Race, age, gender, all of those factors are really critically important when we add an analysis to what's happening with COVID-19. So when I think about what's going on right now, particularly if you think, and going back to the first question, my lens is all about health equity. We're concerned and very much focused on looking at how are Black and Brown people generally in the state of Connecticut faring during this pandemic. Now, here are some things we know automatically that data and research show us. Black and brown people have suffered more poor healthcare outcomes than any other community, and we're specifically talking about in Connecticut. So I want to pause and put a pin before I go into this in detail and remind all of the listeners that you can get very jaded. Well, jaded is the wrong word. You could think very differently about the health and healthcare in Connecticut because research shows all the time that we're one of the healthiest nations in the state. We rank somewhere between 3 and 5 in every single year on the healthiest nations in the state. But when you unpack that data and start to look at health disparities, we tend to rank in the lower half of that number at the same time. So simultaneously, when we rank number 3 or number 5, we rank number 40 or 42 when it comes to health disparities. So looking at COVID-19, we knew this coming into the pandemic, and the pandemic didn't change that. So the data are showing us that Black and brown people are suffering at higher rates of death and cases and contracting the virus. And then of course, the outcomes are not as fair as we would like them to be. So this is when we're looking again at demographics, racial demographics related to who's being impacted and who's not. And then there's also the gender differences. There are some seriously interesting gender differences that are coming up in this data that I think it's going to be worth us examining and looking into, pardon me, over the long term. When I say that, it's to say men are dying more from COVID-19 than women, but women are contracting the virus more and have more exposure. And this is a reason where we have to step back and look at, well, what's going on in the data and how is this happening? Specifically looking at people of color, it's important to think about who's defined as essential workers. And when we look at those workers, who do they tend to be? So I will speak for myself, and others may or may disagree with this, but I know as an African-American woman growing up in the South, my family really hit on education is an important factor, but even when you get educated, it's important to have a job that has utility and usefulness no matter what's happening. So when you translate that, what does that mean? African Americans, Latinos, Asians, Native Americans, and Asians tend to be in roles that put us more on the front lines. Teachers, doctors, nurses, that put us on the front line during this COVID pandemic. Now, teachers, doctors, nurses, those are more of your white collar positions. Let's transition this conversation to thinking about, well, who are the blue collar workers and what do they look like? Our bus drivers, our trash collectors, the people who are working every day in the retail setting. Our grocery stores are still open. Who's your cashier? So when you think about this, those people tend to be, again, people of color. So the pandemic exposure, forgot to add, and a lot of these jobs are filled by women. So when we look at the combination of saying women have more exposure and a lot of what the data are telling us, it's because they're essential workers. People who have not had the liberty or the opportunity to work from home. People see the pillows in my home office right now. That's where I am. Not everybody has that privilege and that opportunity. So again, when we're looking at this pandemic, we're seeing differential impact that is happening on people of color. We're seeing geographic differences. We're also seeing gender differences. And when you lay at the intersection of all of those things for people of color, Black men, Black women, Latino men, Latino women, all of these individual factors come into play to say people of color are going to continue to experience COVID-19 in a different way than others.
Thank you for that. That was a lot of information, very informative and necessary for everyone to hear. Thank you for that. I'm going to move on to the next question. Let's talk specifically about Bridgeport.
Bridgeport. Okay, so as everyone knows, Bridgeport is located in Fairfield County, and Fairfield County is unfortunately experiencing the brunt of this pandemic for our state. When you look at the numbers, particularly looking at the number of positive cases of COVID-19, Bridgeport ranks second overall in the state for the highest number of positive cases. Every day, even though right now, currently, we're having this conversation in early May, and we're seeing a little bit of stabilization in the increased hospitalizations related to this. Paired side by side, Fairfield County overall and Bridgeport definitely, I'm not ready to call it like the epicenter, but it's definitely very much at the top of the list of who's experiencing this, who's being hit the hardest, if you will, by COVID-19. Simultaneously, we know some very big factors about Bridgeport. It is a very big city, and it has a nicely large population of people of color. And I want to pause here and say I keep going back and forth between Black and brown and people of color because I tend to not use the word minorities. And it's specifically because people tend to look at the word minority and think of it about numbers. And really and truly, the terminology minority is about a power indifference and a power balance in America. So when we say minority/majority, or the census is telling us by 2050 will be a majority-minority country, that is a numeric piece, the majority, about a power base, the minority. And so I just want to be clear for everyone listening. That's why you don't hear me say minorities a lot, but when I do say Black and brown, and when I do say people of color, I specifically mean African Americans, Latinos, Native Americans, Asian Americans, and our Arab American and North African brethren, who the CDC actually defined as white, but their lived experience in America and obviously also in Connecticut is much more akin to one as a person of color or people of color. So I just wanted to give that definitional backdrop because I found myself kind of fading back and forth, and I do appreciate that everyone listening, we should all be on the same page. So when I say Bridgeport has a high population of people of color, we also know that Bridgeport is very segregated. So there's a lot of looking at this issue when we start to unpack it to understand much deeper who and how and where are people being impacted in Bridgeport. Unfortunately, I can't really give you detailed data to the penny or to the number about who and how people are impacted in Bridgeport right now, because we just started getting information broken down by data. Data broken down by race and ethnicity. And over 50% of those cases are undefined by race. We don't know where what their race is. And over 500 cases, when the daily reports are coming out, are unidentified by location. So there is still a bit of an unknown, and we're still learning a lot more about how Bridgeport is being faring in terms of this. But I want to pause and repeat a key statistical fact. Bridgeport has the second highest number of positive cases of COVID-19. It is going to be critical and important that all of our communities of color make sure that we reduce our exposure and reduce the exposure of others to COVID-19. Because the other thing we know broadly and largely, going back to that disparities conversation, is that people of color, we're already starting this pandemic further back in the race. We already have communities we tend to live in communities that are densely populated, i.e. Bridgeport as an urban center. We already live in communities that are under-resourced, knowing that there are certain areas in Bridgeport that are food deserts, and not only food deserts, but food swamps. So access to healthy, nutritious foods are limited, and therefore can relate to high stress, and also paired with that, having a higher propensity to have chronic diseases. And those underlying chronic diseases, again, are not good. They don't fare well for positive outcomes from COVID-19. So that's a little bit of what I know about Bridgeport. I'm sure some of you all know a lot more about it living on the ground and being there. But we are, as an organization, and I am specifically pulling for Bridgeport to come out of this on the positive side, and that we can stem the tide of the cases that we're seeing populated and coming up, as well as deter and as well as decrease the number of deaths we're seeing.
Thank you for that. That was really good knowledge and information. And I think hearing that from you, as people hear that, they may take things a little more seriously and do what's necessary so that we can flatten this curve and kind of, get on with this. Thank you so much for that. I'm going to now turn it over to Kim Bianca.
Wow, Tekisha, can we take another hour and just continue this conversation? I mean, what you have shared with us is incredible, and I'm really saddened that we don't have more time. You are on the front lines, and we applaud you for bringing this information to the forefront in such a way. But before we close out, I just have to ask you this one last question, because it is important for us. We hear the information, you've presented data, you told us a lot about how this impacts us, but then we as a community of color need to take responsibility, right? We don't need to wait for someone else to turn the dial for us or to flip the switch for us. So here's my question for you. What can we, first of all, as individuals do to help ourselves? And then what can we as community advocates, what can we do to help in this situation improve and become better?
Thank you. So the first thing I'll say is helping yourself is helping your community. So stay home, stay healthy, and wanting to be very cognizant and saying, if you can stay home, because there are many of us who cannot, and cannot for a number of reasons. If you can't stay home, it is very important that you wear a mask and that you protect yourself from others and that others are protected from you. There are a number of individuals who are asymptomatic. We know and have heard the symptoms. If you have a fever, if you have a dry cough, or it feels like something's happening in your throat, and there's a third one that I'm forgetting right now, but I think we all pretty much know what they are at this point. Those are the symptoms that people know and see and can really quickly figure out that they have things. But there are a number of people who show up and were asymptomatic and are having COVID-19. So it's important that if we are interacting with people, that we need to wear a face covering and have masks on to make sure that we are protecting ourselves from others and others from ourselves. In addition to that, if we do feel like we need to go out and to be around other people, make sure that we're exercising the social distancing rules and that we're making sure we have a safe space between us. Until such time that the CDC tells us that these things are not important, it's really important for each and every one of us to follow the CDC guidelines. And if you're not certain that you know what those are, cdc.gov is an easy place to go and look at that information. Secondly, I would say stay up to date. Now, when I say stay up to date, I don't mean watch the news constantly. I don't know, you may be able to handle it. I'm a person who says this is too much. I cannot listen to this news every single day and hear the consistent reporting every single day. I actually have to take the information in a way that works well for me. So when I say stay informed, that means ct.gov/COVID-19 is a website that can provide a lot of information about what's happening right here and now in Connecticut. If you also want to know specifically about what's happening in Bridgeport, stay tuned and keep in contact with and looking and following what the Bridgeport Public Health Department is sharing in terms of information. If you're someone on Twitter, all of these accounts, the governor has a Twitter account, the Bridgeport Department of Public Health has a Twitter account. You can follow all of this on social media. So that way you're able to control when and how you receive the information. But please, please, please stay informed. The next thing is get into action. If you believe something isn't happening that is fair and just, or you know something that's happening isn't fair and just, speak up. This is not the time for us to be silent. I want to just put a little story to this really quickly by showing you what I mean by speak up. So my staff, my entire staff, all of Health Equity Solutions has been working remotely since about March 13th. And after we all got it together and figured out that our homes were safe, that we had the setups we need to work from home, we immediately started thinking about the COVID-19 pandemic and came to the conclusion that we weren't getting the data we needed to really understand what's happening. So we wrote a letter to the state. Well, first we did an inquiry. So we're advocates in our heart. So we had to step back because I keep saying we wrote a letter, but I was like, wait, well, let's just ask for the information first. And so we wrote to the Department of Public Health for the state of Connecticut and asked if they had racial and ethnic data. We were told and provided a form that they did have, and thought to ourselves, well, that's not enough. And we also asked them to start reporting that data publicly, and we didn't see it. So when we didn't see it, we wrote a letter to the commissioner of the Department of Public Health and the governor and requested that information. The very next day was the first report that the state provided that included racial and data breakdowns of the COVID-19 positive cases and deaths. This is an example of how everyday advocates like you and I can really speak up and make our voice heard. You can do this by reaching out to your local legislators. The legislators are not meeting right now because we're all practicing as a state stay-at-home measures, but they're still very important public officials who need to hear from you your thoughts and ideas about what's happening related to COVID-19. In addition to your to your public officials and your elected officials, you can also reach out to your community leaders and making sure that they know what's happening on the ground and what's important in terms of the needs of information and resources that people in your community need. Listen, I say this all the time. I have a statewide focus, but at the end of the day, if it's not for people like you who reflect back and tell us what's happening locally, we can never do the work that we do, which is telling policymakers, this is what's happening on the ground and this is the solution you need to put into place. And so speaking of that, you can follow us at hesct.org and go to our COVID-19 page where we have a survey that people can fill out that is talking about specifically what are you seeing on the ground in your neighborhood that needs to be changed and needs to be addressed. Because of that survey, we've been able to elevate information to decision makers related to food access needs, related to housing structures and needs. We've been able to explain that it's great that we had PSAs and billboards, PSAs on television and billboards up on the highways, but if people don't have cars and they can't drive, or they don't have cable television and can't see your PSA, how are we getting the information to them? And that helped them to begin to think through other methods and modes of communication. My last point about staying into action, well, it might not be my last point, it's my next to the last point probably. Be on the lookout for resources that are going to be available in your community. I actually know that there are a lot of different activities that are happening right now to make sure that communities of color and under-resourced and underserved communities have access to things such as masks and hand sanitizers and things of that nature. But I do think the last thing I would say is don't be afraid. Don't be afraid. This is something that we can all get through, but for each of us to get through this as a community, we need each of you. So take care of yourself, take care of your families. That helps us to take care of our communities. This is not the time to be selfish and think about your wants and your needs. It's really the time for us who are people of color, and we always do this. We always take care of ourselves. We always provide mutual aid. It's time for us to remember those key tenets of what it is to be a community and be together and look out for ourselves by taking care of ourselves.
Wow. Oh my goodness. So listen, there's just so much information. I want you to share your contact information one more time and also share that link for the survey. Because I hope when you talk about community leaders that pastors are hearing this, because they have a captive audience as in their congregations. I hope that the neighborhood organization leaders are hearing this, because we meet on a regular basis with members of our community. I hope that teachers and educators are hearing this, because they can translate this information to their students who can give it to their parents. There are just so many ways that we need to get this information that you've shared today out to our community. So please, once more again, tell us who you are, where you work, contact information, and that survey link one more time.
All right. I want to thank you all again for this opportunity and having the chance to share this information and to really have an opportunity to just have what I would call a good advocate girlfriends conversation about health equity and what's happening right now in COVID-19. My name is Tekisha Everette, and I'm the Executive Director of Health Equity Solutions. We're a statewide organization which includes a focus on Bridgeport, so we love you too and want to always work to make sure that Bridgeport has health equity. You can reach us at HESCT.org, and in the chat box, which you should be able to see, I've added our website and our specific COVID-19 information on there as well. When we are on Instagram, we are on Facebook, and we're on Twitter. So we're very social media savvy. That's my team. Can't say it's me. And in all of those places, you can find us as Health Equity Solutions or Health Equity CT. If you want to reach me directly, the easiest way to do it to make sure that you have immediate contact and information is to email us at info@hesct.org. As I mentioned, all of us are on stay-at-home orders at Health Equity Solutions, so we will be home until May 20th or longer. We'll see if the government opens after that. So the email is the best way to contact us.
Thank you, Tekisha. You have been absolutely phenomenal. I want to thank our Advocates for Community Awareness team. This has been just super, super great. And again, we thank you for your time.
Thank you.
Thank you.
Thank you.